did my presentation on superficial partial thickness burns. These are also known as first degree burns. They're super common. We've probably all experienced this in our lifetimes. Um, with this type of injury, only the epidermis is damaged, and they usually don't require any medical attention at all. And there's a bunch of different environmental factors that can cause these type of burns. In this type of burn, only the epidermis is impacted, this very top layer here. It damages the stratified squamous epithelium. This could go as deep as the basal layer here, but it doesn't damage the dermis or any of these structures within it. Symptoms are just pain, some redness. There could be some peeling. Generally, with these, you don't get any type of blistering, and there's usually not even much in the way of swelling. These are typically managed at home with basic first aid, though I would caution if you see these types of burns in like an older individual or very young individual or someone who has limited communication, you may want to have this looked at by a medical professional just to make sure it's not deeper than what it appears, since they can't really let you know what their pain level is. So for treatment, immediately remove the source. Obviously, if you grab a hot pot or something like that, you're going to want to let it go. And if you have spilled chemicals or hot liquid on your clothes, you want to remove that. Um, cool the skin. So if you burn yourself on the stove, it's a good idea to just run some cold water over that right away to kind of take the heat out of your skin to prevent it from getting any worse. You may also want to warm the skin if you were dealing with like a burn from something cold, like if you had an ice pack on too long, or maybe you were out in really extremely cold temperatures, you would use warm water for that, just slightly warm, and keep the area clean. So some of the things that cause this, one of the big ones is UV exposure. Sunburns, really common. See this all the time in people. Um, of course, heat sources, cold sources can also cause first degree burns. Chemicals, a lot of times this will happen from cleaning chemicals or just everyday chemicals like acids and bases. I had a little burn once. I have a pool and I used the liquid chlorine and it like splashed up on my leg and I just had like a little red spot from that. And of course, electric sources. As far as safety goes, you want to make sure you child-proof your home if you have small children in your home, to make sure they don't have access to any of these heat sources or chemicals or, um, the outlets for the electric. And just be aware of your surroundings. Heat sources, sometimes you may run into these without even realizing it. Um, we just had these 100-degree days. Sometimes your door handle can get really hot, or like that little buckle on your seatbelt, things of that nature. So, for safety, just make sure your area is safe for children, and just kind of be mindful of what's around you, what's going on around you. And these are my citations. Some of the information came from the textbook, and then, of course, I used some of the sources that were provided to us for this discussion topic. Thank you. Hope you enjoyed it.